Hi, I am Dr. Madhusudhanan. I am a surgical gastroenterologist and liver transplant surgeon at Apollo Hospital, Madurai. This talk is briefly on what is liver transplant and how is life after liver transplant. Liver transplant is done in people who have end-stage liver disease or liver failure. People have a lot of suffering due to liver failure. They will have jaundice, they will have vomiting which can contain blood, they will have a big tummy where we need to tap a lot of water every time. So all these things is a problem that is arising from a bad liver. So these are signs of liver failure. So in these patients, medical treatment doesn't work always. So most of these patients will be better served by a liver transplantation. So in liver transplantation, what is done is the diseased liver that is there within the patient will be removed in total and a new liver will be transplanted for the patient. It is a long surgery, it takes 8 to 10 hours to do, and it takes a big team of doctors to perform this procedure. Again, where are we going to get the liver from? Again, we have two options. If it is a brain-dead donor or a cadaveric donor, the family agrees to donation and the donation happens from a brain dead patient, or if it is a living donor, one of the family members can donate part of the liver for the patient. So these are the two ways the liver will be obtained for a patient having liver failure. Now coming to how the process goes after the transplant. So what happens after the transplant is, the initial period is 7 to 10 days. The patient spends in the liver transplant ICU. There is a dedicated ICU for these patients where the liver function will be monitored closely through 24 hours round the clock. We monitor the patient's vitals like pulse rate, BP, respiratory rate, and we will monitor how the liver is working by doing regular blood checkups and scans, Doppler scans, ultrasound scans if needed. So once the critical period, the first 7 days is crossed, then the patient will generally be in a good shape to walk around and all that. And generally by the end of 10 days to 12 days, the patient will be discharged back home. So that is how will be the first few days after transplant will be. After the first 1 or 2 weeks, the patient is going to feel really well, because this is a patient who suffered from a liver failure and who was in a stage what is called an end-stage liver disease. So they must have had a lot of problems that they used to suffer when they had the liver failure. Now with a new liver in, it is like putting a new engine to a car. So they are going to have a very good energetic lifestyle. They can walk, they can even go back to work after a period of 2 to 3 months. They can enjoy their food very well, because when the patient had liver failure, they will be on a salt restriction, water restriction. After the liver transplant, there will be no restriction. And before the transplant, they will have several admissions due to liver failure. Now after the liver transplant, generally they have to come for a outpatient visit in a clinic rather than getting admitted again and again. So life after transplant is a new lease of life. That is what every patient who had undergone a transplant used to tell us. They feel very energetic, they can go about their life, they can have a life that they had dreamt of. So that is how life changing the transplant is. And regarding the survival, if the patient had not undergone a transplant, the survival is only counted in few months. But after a transplant, 5-year survival, 10-year survival, and survival beyond 10 years is also becoming a reality for more than 60 to 70% of patients. Now, especially if you are doing transplant for children suffering from liver failure, they are going to have a near normal adulthood life. So that is in short about what they can expect from a liver transplantation. Thank you.